Hi, I'm Dr. Joe Thompson of the Arkansas Center for Health Improvement. As our healthcare system becomes more complex and more integrated, I'd like to spend a few minutes today just to discuss who gets to determine who provides what care when and in what circumstance. Our state has licensing boards. That's because there is no federal law that actually dictates how medicine is practiced. We have licensing boards for the medical license, we have licensing boards for nurses, we have licensing boards for pharmacists. Those boards determine who gets to practice as a physician, as an advanced practice nurse, as a pharmacist, based upon education and testing, and sits before the board applying each year to make sure that they're in good standing. The board defines what the scope of practice can be with guidance from the legislature, and also what the standard of care is. And finally has the authority that if the standard of care is not maintained, they can discipline a licensee by either sanctioning the individual or even removing their license. Now, the boards get their authority from the legislature. The legislature tells them what the appropriate scope is for the boards to be able to license individuals. The governor appoints members to those boards, and that's how our setup is to license physicians, nurse practitioners, and pharmacists here in the state. Now, there are other players. Over on the right are credentialing organizations. These are national organizations that credential specialists. I, as a pediatrician, am credentialed by the American Board of Pediatrics. Every 7 years, I have to sit before that board, take a test, and prove that I still know everything I need to know to claim to be a pediatrician. There are other membership associations. These are associations that people purchase membership on so that those associations represent the interest of the licensed providers. This would be the Arkansas Medical Association, the Arkansas Nursing Association, the Arkansas Independent Pharmacy Association, and their national counterparts, the American Medical Association, American Nursing Association, and so forth. These associations are membership associations to advocate, both in the legislative body and other areas, on behalf of the licensed individuals for each of the specialties. On the left are payers. We have private payers, we have Medicaid, Medicare, the VA. Payers can actually make payment determinations of who they will allow to do certain services that they will pay for. All this milieu comes together, particularly as we have scopes that overlap between physicians and advanced practice nurses, between physicians and advanced practice nurses and pharmacists. And if the political process breaks down, it comes back to the legislature for an explicit decision to guide and support the boards in execution of their responsibilities. This is a complex set of issues. It is determined at the state level how our healthcare system is functioning and who gets to do what. I encourage you to pay attention to legislation moving forward and educate yourself so that we get the best performing healthcare system in the state. Thank you.